am Dr. Kanakadurga, social work educator, retired from PG Center of Andhra University. Counselling is an interactive process, and its unique characteristic feature is relationship between the counsellor and the client. The counsellor keeps in mind what result the client desires and also of the goals which the counsellor sets with the series of events. In bringing the goals, process goals are plans for the events that take place during counselling process. Objectives. The objectives of this lesson is to explain the series of events and stages of counselling right from the beginning of the client's admission to the agency till the problem is solved. The meaning of the process in counselling is as follows. There is a broad sense in the word process, where any activity involving change can be described as process. The term process is used in research literature to refer to a wide set of factors that may promote or inhibit therapeutic effects in clients. Third meaning of process is found mainly within the humanistic perspectives on the therapy. The definition is characterized this process as an essential human quality of being and becoming. Life is dynamic and changing process in which nothing is fixed. The change takes the client in the direction of goals to be achieved. A fourth sense of process, that is something used by counselor and psychotherapists, describe the way the clients in therapy attempt to comprehend or assimilate difficult experiences in their lives. The counselor establishes professional relationship based on trust, respect, and mutual purpose. The counselor, when establishes professional relationship, the positive psychological climate is created between the counselor and the client. When the rapport is established, the client is cooperative and more open to disclose his or her problems, which leads to the solution of the problem. In order to establish positive professional relationship, conditions like empathy, genuineness, and unconditional regard and care are required. The counselor accurately senses the feelings and personal meaning of the experience of the client and communicates his or her acceptance to him. Listening to the client will help the counselor to know the experiences of the client since childhood up to the present, either with the feelings of security or insecurity. Clients' verbal and non-verbal voice, facial expressions will give information to the counselor. Empathy is an intellectual and emotional skill that requires patience. Genuineness is counselor's state of mind. Counselor can respond as a human being and not as a therapist. The genuine counselor is the one who is congruent, spontaneous, non-defensive, consistent, and comfortable with the client. Congruence means action and feelings are consistent. The counselor is comfortable with HIV positive persons, but in actual practice, it is seen that is incongruence and it is to be avoided. Spontaneous means one should be tactfully honest. Counselor should not be a formal person. Positive regard is counselor treating the client as a person with inherent worth and dignity, regardless the client's behavior or appearance. Warmth is the ability of the counselor to convey genuine caring and concern for the client. This is acceptance and desire for well-being of the client. Warmth is communicated through non-verbal behavior such as smile, tone of voice, and facial expressions. All the qualities are conveyed to the client through verbal and non-verbal behavior. This helps in building a relationship with the client. The greatest obstacle for building professional relationship of the counselor with the client is that of counselor has a tendency to move too quickly towards the goal. The counselor has to wait and observe the feelings of the client and also wait to observe the change in the behavior of the client. Though the term diagnosis is taken from medical profession, the diagnosis and assessment in counseling is different. As medical man, the physician asks questions, elicits information, and assess or diagnose the problem of patient by himself and suggests treatment to him or her. But in case of counseling, the counselor asks questions and elicits information for diagnosis. He or she involves his or her clients in interpreting the problem, in the assessment, and finally in the treatment. Rogers believes that physiological pain and dysfunction are best resolved by a partnership with a committed helper. Assessment is bilateral activity. Counselor and clients do not always become aware the likely diagnosis as it provokes the feelings of pain and anxiety and blocks full awareness of difficulties or their causes. The counselor should not announce his or her assessment immediately. The client may not be able to grasp the assessment and the ongoing intervention till the defenses are lowered. Sometimes the counselor may go wrong in his assessment and suggest a faulty diagnosis and a wrong intervention. Even if the counselor is able to arrive at accurate diagnosis, when the client's defenses are not lowered, the client will reject the diagnosis and the treatment. The presentation of diagnosis by counselor to the client imply that solving the problem is the responsibility of the counselor and not that of the client. Thus, a unilateral diagnosis by counselor can undermine the partnership essential to the effectiveness of counseling process. Understanding the degree to which present problem influences functioning in the other parts of client's life. For example, if a woman comes to counseling because of worry about the future and the sense of emptiness and dissatisfaction in her choices, counselor has to explore effects on her daily living and on relationships. Exploration of the ways of solving the problem that the client has already tried before entering counseling relationship. An understanding of the strengths and coping skills of the client. Too often, strengths are not clearly identified, but knowledge about strengths is necessary for the following reasons. The information helps both the counselor and the client keep a balanced perspective. Evaluation helps counselor that the client can take up his responsibility. The assessment of strengths assists the counselor in avoiding either pitying the client or taking a parental role with the client. Knowledge about strengths and coping behavior of the client helps the counselor to choose an appropriate therapeutic intervention. Preparatory stage. The formalities for admission of the client are fulfilled. The counselor makes the first contact with the client and finds out where the client is in his or her life and tries to find out the current difficulties. Because of his or her relationship, the counselor prepares the client to know the counselor, agency, and its service. He or she communicates the rules and purpose of interaction along with certain practical arrangements to attend sessions in the agency. As the purpose of interaction is discussed, the client will come to an understanding what is going to happen in the sessions. The client and the counselor will come to an understanding the boundaries of expectation, problem details, and goals they set for their work. In the beginning, the client will have all sorts of doubts with regard to the efficiency of the counselor in solving the problems. The client is also indifferent with that he or she share all his thoughts, feelings with the counselor. Once the rapport is established, in-depth exploration is made possible. Goals are discussed. All this will happen because of the social skills of counselor, resulting in improved interaction, respect, genuineness, and empathy of the counselor. He or she is able to set goals acceptable to the client and with the client. A plan of action is developed as the interaction of the counselor and the client is progressed. The new information emerged sometimes will change the plan of action, assessment, and dialogue. 2. Exploratory stage. In this stage, the client builds trust in counselor and begins to talk freely about the problem. Because of the attention and concentration the counselor is paying during listening, the counselor will get information of the problem of the client. The posture, facial expressions, and eye contact will give more information about the problem of the client and about his or her environment. Both counselor and the client, after a great deal of discussion, will understand the probable factors that create and maintain these problems. They will also analyze the probable factors that relieve his or her problem. The counselor improves the understanding of the problem, causes of the problem, and effects in the ways of solving them. The counselor explores the information about the client's personality and his or her life in order to have complete picture of preparing the plan of action and encourage them to therapy to deal with the problem. The client's adjustment at home, at work, with friends, persons of opposite sex, and with the society in general are explored. The client's strengths and weaknesses, habits, likes, dislikes, and the client's way of management of his life also gives an account of potentialities. Planning stage. The counselor again summarizes what all the information the client has given in the first stage with his or her diagnostic impressions of the client's dynamics and coping behavior. In other words, counselor tries to assess the problem and his situation. The client with a problem, with a hope to improve his or her situation, is entering the agency for counseling. Assessment takes place right from the beginning of counseling process, and it is continuous throughout the process of counseling. The counselor is assessing the client not to judge him and also not for evaluation. The purpose of assessment to seek clarification, to know more details regarding client's problem and situation. The assessment will enable the counselor to make an accurate diagnosis. The counselor, with his or her assessment, will try to select a suitable treatment plan. The assessment also helps the counselor know more about the environment of the client. Assessment also facilitates the counselor to generate options and alternatives to the client. When the assessment is wrong, the outcome of counseling fails. Keeping in view the need for correct assessment, the counselor has to plan for treatment. With assessment, the counselor can understand the potentialities and limitations using his or her assessment. The counselor sets goals along with the client. 1. The counselor determines the client's readiness to negotiate goals. 2. The counselor will explain the purpose of selection or defines the goals. 3. The counselor helps the client to select appropriate goals and define them clearly. 4. The counselor determines feasibility of the goal and discuss the potential benefits. 5. The counselor helps to choose the goal for his or her solving the problem. 6. When the problem is split into parts and made simple, that is partialization, and has to set priority, meaning prioritization of attending each part has to be explained to the client. Action stage. The counselor will develop the strategies for action to reach goals. The resources are identified, basing all on the needs of the client. The counselor will use treatment model basing on the need therapies like rational emotive therapy, transactional analysis, psychotherapy. Finally, the client will gain the benefits. Resolution of emotional cases, resolution of problem behavior is seen. Self-confidence and self-esteem are improved. Self-control and frustration tolerance enhanced. Reality orientation and appraisal of threats is impressed. The client is benefited with communication and problem-solving skills. The capacity for judgment and emotional stability of the client are strengthened. Termination stage. Evaluation means to review how the client has taken action in order to reach the goals. The counselor has to review the client's efforts to reach the goal. With the evaluation, the counselor will come to know the readiness of the client for terminating the counseling session. The counselor has to inform about termination of the case to the client. The counselor has to assess the readiness of the client. The counselor, while reviewing the case, he has to emphasize client's efforts in effective change. The client is given the instruction to maintain the same improved situation. The counselor also gives assurance for his or her availability in case of relapse and dysfunction. In this lesson, completely the process of counseling is discussed. The counseling has 5 stages, that is, preparatory stage, exploratory stage, planning stage, action stage, and finally termination stage. And these 5 stages, right from the beginning of admission of the client till in helping the client to solve the problem, the counseling will be done.